Hi, I'm Raquel Robinson with Agenda Jamaica, and we're here at the Spanish Court Hotel in Kingston, Jamaica for the Fix My Food Jamaica launch event. The initiative is in collaboration with UNICEF, and Jamaica is the first Caribbean island to implement the program. This is Agenda Jamaica's coverage of the event. Pleasant viewing.
So, my name is Ruth Lawrence, and with me is my co pilot on this ship this morning, or should I say plane? Airplane? All right, on the aeroplane this morning. The Fix My Food Flight 102 this morning is Savion McFadden. He is my co host, and we are going to be working with you this morning to, just manage the flight together. But firstly, I want to ask Savion, why are we here this morning?
Well, Auntie Ruth, as we so affectionately like to call her, today we're here to really explore, food environment, specifically around front of package warning labels, and we also want to get some feedback from the youth as well as policy stakeholders as to why it's important and how we could possibly bolster it for all of us here in Jamaica to experience healthy living. No, sir.
Love that,
Yeah.
love that. And guess what? Today is a big deal. So I want you to turn to the person beside you and say, it's a big deal. So just in case you are here and you are wondering, what is Fix My Food? Because naturally you're here at the Fix My Food launch Jamaica. So Fix My Food was launched in Vietnam, Mongolia, South Africa, Fiji, in 2024. Jamaica became, of course, the first country in the Latin American region to soft launch Fix My Food. Now, it's a global youth movement. Fix My Food Jamaica is led by UNICEF and supported by Bite Back 2030 in partnership with the Jamaica Youth Advocacy Network. Fiwi Children Foundation and youth organization engages young people in advocacy for healthier food environments.
Absolutely. And this hard launch, as I said before, will be exploring the developments surrounding food environments with a specific focus on front of package warnings and other food environment policies. And thematically, this forum is going to amplify our connections with young people and policymakers through robust panel discussions. And at the end, we'll be culminating all of this with a youth-led position paper on front of package warning labels.
Love it, love it, love it, love it. No, I love the theme that they're working with, or should I say the tagline. It says, "It's not too late to fix your plates." No, I want you to just turn again, because today we're going to get friendly with each other. We're going to get to know each other. So turn to the person beside you, whether it is on your left or on your right, and say to them, "It's not too late. Fix your plates."
Try again, man. Try again. One more time.
It's not too late. Come on, tell them.
Again, man. Right.
So fix your plates. Love to
Nice.
hear it.
Last year, Jamaica was proud to be the first country in the Latin America and Caribbean region to soft launch this initiative. And today we mark a major milestone in bringing it to life, together and with our young people at the center. We know the stakes are high. Our children are consuming unhealthy diets, often marketed to them as appealing, while nutrient-rich options remain out of reach. Many are also physically inactive. The result? Increasing rates of childhood overweight and obesity, and modifiable risk factors for the early onset of non-communicable diseases like diabetes and hypertension. And once, when I was back in medical school, which was years ago, decades ago, right? It was 65 years and older that we were taught had diabetes and hypertension. That is no longer our reality. So it's not a distant threat anymore. It's actually here. Younger and younger persons are coming down with NCDs. 68% of Jamaican students aged 13 to 15 drink carbonated beverages daily, and nearly half consume sweetened drinks 2 or more times per day. These patterns, driven by the aggressive marketing of ultra-processed, low-nutrient food and drinks, demand urgent attention, not just from policymakers, but from all of us. This is why we are so pleased with Cabinet's approval of the National School Nutrition Policy, which sets a clear framework for improving school food environments, reducing salt, sugar, and harmful fats, and ensuring children are offered healthier options. But we know that school-based reform is simply not enough. We want, ladies and gentlemen, to take advantage of the opportunity to act now. While the government remains committed to introducing front-of-package warning labeling as a policy tool to support healthier food choices, no final decision has yet been made regarding the specific format that we will adopt. We are continuing to examine the evidence and engage stakeholders to ensure that whatever solution is chosen will be practical, effective, and aligned with our national health goals. We also acknowledge the strong and growing voice of young people in this space. And today's campaign is a clear signal that youth are not just concerned. They are informed, engaged, and eager to be part of the solution.
It is an honor to address you today at the Fix My Food Jamaica launch, a significant milestone in our collective effort to create healthier food environments for children of Jamaica. Feed My Food is a good global UNICEF-led initiative that empowers young people to advocate for healthier food environments. In Jamaica, we are proud to see that 10 youth groups have come together to launch Fix My Food Jamaica, the first of its kind in the Latin American and the Caribbean region. At UNICEF, we firmly believe that every child has the right to good nutrition, to grow up healthy, and to reach their full potential. However, we recognize that these rights are not realized by chance. They are achieved through deliberate policy, concentrated actions, and by listening to the voices of those most affected. Many of us in the room are advocates for the protection, promotion, and fulfillment of children's rights. However, it is our young people who will live with the future consequences of policy decisions taken today. In Jamaica, there is an alarming rise in childhood overweight, obesity, and non-communicable diseases. These trends are not merely statistics. They are indicators of systemic failures in Jamaica's food environments. While the scientific evidence is clear, the implementation of effective solutions often face delays. Through the Fix My Food initiative, youth are not only participating, but they are also leading the charge for positive changes. They are advocating for healthier food in schools, front-of-package warning levels, and restrictions on the marketing of unhealthy foods. Today's event is a testament of the power of youth advocacy. To our partners, the Jamaica Youth Advocacy Network, Be With Children Foundation, young advocates present today, your determination, clarity, and commitment inspire us all. UNICEF is proud to stand with you as we issue a collective call to action for all stakeholders to contribute in building a food system that puts the health of children and young people first through the implementation of evidence-based policies. Together, let us fix Jamaica's food system for the benefit of Jamaica children and the society as a whole. Thank you so much.
Our collective commitment to advancing youth rights and public health is what brings us here together today, and our joint purpose for this movement. Today's launch is not just about unveiling of a campaign, it is a celebration of determination and passion for young people desirous of making a difference. Fix My Food Jamaica has been developed by youth for youth. From the design of the messages to the faces behind the videos and visuals, young people have shaped every aspect of this campaign. Our lived experience, our voices, and our creative energy have defined the tone and urgency behind the call to fix the food systems that continue to fail us. You will note that I say "or" because I am also a young person. I'm a Gen Zer. So I just want to ensure that I'm also recognized in the movement. This movement is more than just about food. It's about rights. Access to healthy, affordable, and safe food is intrinsically linked to our right to health, a right that all Jamaicans, especially our children and young people, must be guaranteed. Policies like front-of-package warning labels and the National School Nutrition Policy are not just technical reforms, they are human rights tools. They help us to build a society that respects, protects, and fulfills the rights of every child to survive and to thrive. Healthy food policies are not fringe issues. They are fundamental to the development of children and youth. They influence how well we will learn, how long we will live, how we will contribute to society, and how we will break intergenerational cycles of poverty and diseases. The call for nutrition justice links directly to the several sustainable development goals, including good health and well-being, quality education, zero hunger, and reduced inequalities. As we officially launch Fix My Food Jamaica, we are also affirming our connection to a wider global movement, all rising up to demand that our governments and all stakeholders protect our health, our futures, and our dignity.
So the food environment really refers to all the places that we have access to foods, as well as the type of foods available, and the nutritional quality, the affordability of these different foods and diets, and the way that food is marketed to our children. So because of this, I want to really look at the word accessibility. Accessibility in these places of how affordable it is, the money that it costs to really get healthy foods in our country, as well as accessibility with the distance of a healthier food option. In our average environment and our average thoroughfare, you'd see, as I said, a lot of fast food options, a lot of supermarkets selling more ultra-processed foods and high sugary drinks, and those aspects are those, for example, foods that are in our space, in our environment. And because of that, it contributes to an unhealthy food environment. Now, there's two environments. It can be healthy or an unhealthy food environment. And unfortunately, our space constitutes or promotes a more unhealthy food environment. But what constitutes for a healthy food environment, as it says, is that an easier access to healthier food options, reduced targeted ads to our children, and the availability of more nutrient-dense foods versus calorie-dense foods.
What effects do you see this will have on youths in the future when it's actually implemented?
It's going to take time. You know, like even our obesity and overweight rate, we didn't get it overnight, you know. It took years. I mean, maybe not you, you are a young and slim lady, but like me, I'm just saying, when you look back, you put on all this weight. You didn't put it on in a year, you put it on in years. So the fact is, even in terms of reducing the sugar and having people get used to the taste, it's going to take time. But at least we have a policy, because the Ministry of Health is going to be overburdened with the healthcare costs of people coming into hospital, staying, and medication. But the fact is, now we have a policy, we have something to work with. And we have gotten a lot of support from our teachers, our vendors, you know, because once people understand the health issues, then they're more likely to help to support nutritious eating.
A big part of Jan's work is actually nutrition advocacy, so it was a no-brainer that we'd be involved in Fix My Food Jamaica. So when UNICEF asked us if we'd step in, we said, of course. Nutrition is our bread and butter at Jan. We have advocated over the past, 5 years for the implementation of the National School Nutrition Policy, which was tabled back in April, a couple weeks ago, and of course, front-of-package warning labels, and that's the root of Fix My Food Jamaica. So it's nothing new to our advocacy. We just jumped on the opportunity to advance it in this way.
One of the big things is the school nutrition policy. We've been working with JAN, Jamaica Youth Advocacy Network, with the Ministries of Health and Education, and we're really pleased now that Cabinet has approved this policy that will now govern how healthy foods are more available, more accessible to children in the school environment. That is a massive step forward for children, for the health of children. We are working now with our colleagues in both ministries to make sure that they have the capacity to implement the policy. And also, there are so many stakeholders within that environment. So parents, the children themselves, the people who sell the food at the school gate and in the canteen, many stakeholders to work with and quite a bit to do to make sure that the policy is fully implemented.
On behalf of Few Children, a youth-led NGO, I'm honored to be a part of this important conversation, one that speaks directly to the health, development, and future of Jamaica's children and youth. We are here today because we recognize a simple, powerful truth. The state of child nutrition in Jamaica needs urgent and lasting improvement. It's not just about whether children are eating, it's about what they are eating. And nutrition isn't a luxury. It is a right and a foundation for learning, growth, and success. At Few Children, we speak daily with youth across Jamaica. One theme comes up again and again: the struggle to access healthy, affordable meals, especially in schools. I remember facing those same choices myself just a couple of years ago. Often, it was sugary drinks and fried snacks, not out of ignorance, but out of necessity.
Fix My Food is the UNICEF-led global youth movement. And the genesis of this program was from 2021. Okay, good. Which highlighted the demands of 700 young people from 18 countries on how they wanted to transform their food systems. And the Fix My Food initiative is currently launched in Vietnam, Mongolia, South Africa, Fiji, and Jamaica as the first in the LAC region. Can we give these countries and Jamaica a big round of applause?
Can you tell me a bit about what we have on display right here?
Okay, what you're seeing here is some of the foods that have hidden sugar or added sugar. And when people go, say, to the supermarket or they go to a fast food and they'll have 300 bottle of soda, they have no idea it's 17 teaspoons of sugar. A 2 liter, certain fast foods you get a 2 liter free with your whatever, 52 teaspoons of sugar. And the fact is, the World Heart Federation recommends 6 teaspoons added per day, added, not natural sugar, and under 6 for young people. So part of the problems of overweight and our non-communicable diseases are related to our excessive sugar intake.
I have been with the Heart Foundation of Jamaica and these health advocacy groups for about 8 years now. So it's really a pleasure to just join together with the teams and to have a stronger push for our healthier school food environments, healthier food environments, and when youth voices are pushed in it, stronger, more powerful, having the youth speak about their health.
So for our children, we want to ensure that throughout the day, they have a variety of nutrients from the different food groups. We know that for the food groups, we have our staple, which are major sources of carbohydrates in the diet, but you also have food from animals, which are good sources of proteins, but they're also sources of a combination of healthy and unhealthy fats. So you have to be careful with the portions of food from animals and also how you prepare them. And then you have your legumes, very important for providing not just proteins, but also good sources of fiber in the diet and a range of nutrients that children need, vitamins, minerals. And then you have your fats and oils. Again, you don't want to have the children having too many saturated fats, which are the solid fats that can contribute to poor health as they get older. You don't want to, contribute to the development of heart disease and clotting of the blood vessels. You also want to ensure that they have adequate fluid throughout the day. So looking at the different meals, you start your child with breakfast to give them that start to the day that they need to support learning. So you want to ensure that they have a combination of a staple, as well as food from animal to go with that, along with your fruits. And then for mid-morning, usually break time, you will have them, have a fruit or some nuts or a combination. So things like, fruits are usually very good snacks.
We're very excited because since 2019, the Ministry of Health and Education put a gradual reduction in sugary drinks in schools. It was 6.5 per 200 mil, and now it's down to 2.5. But that was over a period of years. So the idea is that it will restrict the amount of sugar that our children are getting in schools. Of course, it's difficult. We'll have to monitor to make sure that that is happening. And then what happened? COVID just messed that up, between 2020 and 2022, because schools weren't open, that kind of thing. But the school nutrition policy now has been approved by Cabinet, and it has, different areas that will help to have reduced sugar and nutritious foods as well. And that's what's important.
So firstly, I just want to get into what U-Report is. So U-Report is a global digital and social messaging tool that allows for young people to be a part of a movement where we garner their opinions on various issues of national or regional or global interest, where they're able to use their voices to participate in data collection, and they're able to really share their opinions on these important things. U-Report is really the largest movement of this nature that allows for young people to share their voices and have that research present that is youth-driven. And U-Report not only utilizes the data that young people share to, provide research, but U-Report also provides support for young people with that data. So we look at how it is that we can use the data to then provide services or anything that is necessary for young people based on what it is that they need or want.
According to the data from Fix My Food, children who are healthier are more capable of learning. This event has showcased so many issues that need to be addressed in order to move forward as a nation. I'm Raquel Robinson, and this has been Agenda Jamaica's coverage of Fix My Food. Thank you for watching.